My name is Alistair Martin, and I'm an ER physician at Massachusetts General Hospital and the founder and executive director of Vot-ER. Vot-ER seeks to initiate and grow a civic health movement that aims to convert our healthcare settings in this country into the front door for civic engagement, voter registration, and for voter turnout. Vot-ER has helped nearly 50,000 people with voter registration, getting their mail-in ballots, and making it easier for folks to vote in the 2020 presidential election. And we're just getting started. Before I tell you about the civic health movement, I want to tell you a quick story about a patient that I had a few years ago. I was taking care of a patient about 3 or 4 years ago at Boston Children's Hospital. She was in her mid-20s and a mother of 2. And she came to our emergency department with a story that I'll never forget. She came in and said, "Doc, look, I had to escape an abusive situation in another state, one that I knew if I didn't move my kids and I out, we would be in harm's way. And so a few months ago, I moved in with an aunt here in Boston, and things had been going well for the last couple of months, but the last couple of days, things really started to kind of deteriorate with my aunt and I, and she kicked us out last night. And my kids and I slept in the van, last night, and it was desperately cold. And I knew that I couldn't do that to them again tonight. It's February in Boston, and it's 2 degrees, and we didn't have anywhere else to go. So we came here. Can you help us?" And as an ER doctor, this is not an unusual story. We take care of folks who are struggling with homelessness, who don't have a place to sleep at night, folks who are desperately hungry and have access issues with regard to food and food insecurity, and folks who struggle to keep insurance and need folks to write them a prescription or a work note. But this was an unusual situation in the fact that she was there with her 2 children, and I didn't really know what to do in order to get them shelter for the night. So I called the social worker, who social work often plays a really critical role when it comes to addressing the social determinants of health in a hospital. And I asked, we've got this woman here with her 2 kids. I don't feel comfortable sending her to a shelter. What are our other options? And the social worker said, well, look, if she's a Massachusetts state resident, we can get her into long-term transitional housing as long as she provides some proof of residence. So I go back to the room and I ask the patient, I have to, ask you a quick question. Do you have, a check stub or a phone bill, something that shows that you're a resident of the state? She says, no, doc, unfortunately, as I told you, I just moved from another state. So I went back to the social worker. I said, unfortunately, she doesn't have proof of residence. What are our other options? And the social worker said, well, we don't really have any other options, except there's this one thing that we can do. I said, what's that? And he said, well, we can register her to vote. Her voter registration would count as proof of residence in the state of Massachusetts. So I went back and talked to the patient, and I asked her, look, we're definitely going to help you, but I just want to ask you a quick question. Do you want to register to vote? And her response shocked me, and it might shock you as well. She said, I didn't know I could. No one has ever asked me if I wanted to be registered to vote before. And she's not alone. In this country, we have over 51 million people who are eligible but unregistered voters. That's the entire population of Spain. And when you ask these folks who are not registered to vote, why? The vast majority of them have simply never been asked to register to vote. They're missing that invitation to sit at the table of our democracy. And in healthcare nowadays, there's a lot of conversation around the social determinants of health. How do we address what are known as the causes of poor health, the things that lead to health-related social needs? This patient came in with a health-related social need. She needed shelter for the night. If all I did was address her social determinant of health, which is get her into a transitional shelter, what about the 5 patients that are in my waiting room also struggling with homelessness? What about the 5,000 that I will see over the course of my career? If all we ever do is address the social determinants of health, we will just simply be playing whack-a-mole with these social issues. The way to truly impact the social determinants of health is to go upstream and to address the causes of the causes. The only way that we can do that is by voting. Voting is the quickest and most effective way to address these upstream structural determinants of health. The problem is that our most vulnerable patients are quite often the same exact demographic groups that are unregistered but eligible voters. They tend to be younger, they tend to be more low income, and they tend to be people of color. And why is that a problem? Well, it's a problem because when people don't vote, they're labeled as unlikely voters, and campaigns don't make contact. Why is that an issue? Well, it's an issue because if those elected officials eventually ascend to public office, those patients' perspectives, their desires, their wants, the pieces that make up their daily realities are not incorporated into decision-making for policy creation. And this has very, very real outcomes, health outcomes. Let me show you one example of the many studies that we've done. This pattern that I will show you exists across every single major US city. This is East Harlem in 2018. This specific precinct had a 35% lower voter turnout rate compared to city turnout in the 2018 mayoral election in New York City. That same precinct maps onto a census tract that has an average life expectancy of nearly 20 years lower than the rest of the state. That specific portion of New York City. But let's go to Detroit in case you think this is just a issue that folks in the Excelsior state have to deal with. Southwest Detroit has over 24 industrial sites, things like cement plants, oil storage plants, power stations. Folks who live in this corner of Southwest Detroit live 7 years less than the US as a whole. And they're hospitalized for things like asthma and heart attacks at much higher rates. It's no surprise to you then that when we look at the voting rates of Southwest Detroit, they are dramatically lower in terms of civic engagement, civic participation, voter registration than other portions of Detroit. Now, going back to this slide for a second, these refineries, storage plants, and chemical plants had to go somewhere in the city of Detroit. And when it came time to make the decision around where do we put these, I conclude, and many others agree, where folks are voting, where they are active, where they are part of the democratic process is not where these sorts of industrial sites or other pollutant generating industries end up getting distributed. And that has real impacts on who I see in the emergency department, who we admit to our hospitals, and who we have to bury years earlier than we should have because of their life expectancy dropping. And so if you are truly interested, yes, you, in addressing the racial and social inequities in healthcare, if you really want to make an impact, you have got to be invested in concrete actions rather than optical or performative solutions. What is optical allyship? Optical allyship is defined as allyship that only serves at the surface to platform the ally. It makes a statement, but doesn't go beneath the surface and is not aimed at breaking away from the systems of power that oppress. That's from Latham Thomas. And so when we see things like this, AMA policy recognizing racism as a public health threat, while there are good signs there, we need to see how this is related to, linked with, and correlated with action, concrete action. And it's not just me and scholars throughout the country who believe in this. Look at the National Academies of Science, Engineering, and Medicine in their 2019 report. They outlined the 5 A's strategy, which urged health institutions like hospitals, like clinics, like community health centers, to shift from just advocacy-based, awareness-based initiatives to advocacy-based initiatives, concrete, real initiatives that make impact. And so why is voting so important, and why does voting matter? Voting matters because when people vote, they're labeled as a likely voter, campaigns make contact, and their perspectives, their needs, their desires, the issues that make up the daily realities in their communities are incorporated in the policymaking process. Where healthcare providers come in and hospitals come in is we can promote voting in a way that's nonpartisan, non-interruptive, and non-coercive. Why? Because the 1993 National Voter Registration Act not only legalizes voter registration to occur in healthcare settings, but it encourages it. Vot-ER makes it easy for hospitals and healthcare providers to do so. And we do so with these 3 tools. The first is called the Healthy Democracy Kit. This is a lanyard that physicians or other healthcare providers wear that is used as a visual cue for patients to ask about. And when they do, they're directed towards something called the badge backer. This is my Healthy Democracy Kit. This is my ID. When patients ask about my badge, I say, yeah, or my lanyard, I say, yeah, you know what? It does say vote on it. Because if you want, I want you to take 30 seconds right now and use this QR code or that text message code to check your voter registration, or to get a mail-in ballot to make sure that you can vote by mail, for example, as was very, very important last election. Folks can also use these kits to register to vote. We have 24,000 physicians, nurses, medical students, social workers across the country who use these kits on a daily basis. They are free for providers, and we ship them within about 2 weeks to any healthcare provider who wants one. Secondly, we create what we call a site-based tool, which is where we create posters and discharge paperwork that hospitals and healthcare facilities can put in their waiting rooms or clinics. And these posters allow patients to register to vote while they're sitting there waiting in the waiting room. They're on their phones, they can shoot that QR code or send a text message, and they can get registered to vote. And the best part is we track all of the activity and give it back to the hospitals. And we tell them, Johns Hopkins, just last week, you helped 355 patients with voter registration. That's 10 more than Massachusetts General Hospital. Good job. We also work with community health centers to help send text messages to their patients, which offer an invitation to use this platform to register to vote. I want to tell you a story about one of our physicians. This is Dr. Stager, who's a pediatrician at Metro Health in Ohio. She uses her Healthy Democracy Kit every single day in something called her social history, which is a history that doctors have to take. She asks, are you a smoker? Do you drink? Are you registered to vote? And using that social history mechanism, she's able to start the conversation with patients. And if folks are interested, she can then refer them to her badge, and they take care of the voter registration on their own phone, on their own time, while Dr. Stager goes and sees the next patient. Again, there are over 24,000 healthcare providers like Dr. Stager out there who have one of these kits. Out of the 24,000, 60% are physicians, folks like me who've graduated residency and are out there practicing. 23% are medical students, 10% are nurses and PAs, and then 7% are social workers. We've got several forthcoming academic studies from this work, from the 2020 election, and this is one of them that demonstrates when we surveyed our healthcare providers, we asked them, why are you helping people get registered to vote? The number one answer was not the election. The number one answer was, I want to address the social and racial inequities that I see on a nightly basis. You met Dr. Stager. Now I want to introduce you to one of her patients. Lauren is 19 years old, and NBC News stopped by Dr. Stager's office last October and did a story on both of them. Lauren had never registered to vote before, and while she was in Dr. Stager's office, she registered to vote for the first time because Dr. Steger was wearing one of these. Not only did Lauren get registered to vote, she then went home and helped her sisters and her parents who were never registered get registered to vote, and all of them voted for the first time. We know we've helped over 46,000 people like Lauren through the Vot-ER platform. When we look at the demographic data of who we've been able to help, the data demonstrates that the folks that are being impacted tend to be more diverse than the average American and also younger than the average American, with about 50% of those helped being people of color. And so overall, we helped just over 46,000 people with the voter registration or mail-in ballot process. And we actually followed up to see on the voter file who voted. And almost 70% of those folks who completed the voter registration or the vote by mail process actually turned out in 2020. We have over 24,000 healthcare providers who use these kits on a daily basis, over 700 hospitals, clinics, medical schools, and health centers that have these posters or these discharge paperwork, and over 100 medical associations and national organizations that partner with us to do this work. And we're just getting started. Within the next 5 to 7 years, we will be in the majority of all 53,000 non-urgent healthcare settings throughout this country. Many folks think a lot about this concept of how much does it cost to register someone to vote. Many interventions are in the $90 to $150 range when you really think about this population and how much goes into trying to make sure that these really hard to reach populations vote. We are well underneath that for folks who are interested in the financial approach here. And this bodes really well for the future and the viability of this model moving forward. But it's not just about traditional campaigning. Presidential elections, senatorial elections, congressional elections all use this model that's on the left here, which is really a mobilizing only model, where immediately before the election, you try and ramp up activity and energy, and then after the election, you kind of just put everyone away. That is not our style, and that's not our strategy. What we do is a combination between mobilizing and organizing. We build excitement and energy among healthcare providers before the election, and we organize in between the big elections, continuing to build the base of power and continuing to create the sustainable structure that we need moving forward. So what does that look like? It looks like the Civic Health Fellowship, which we started in April. It's a 10-month-long community organizing training program for healthcare providers where we teach them the nuts and bolts of community organizing. And it's not just about a didactic session. They actually have to get out in the community and organize all throughout the 10 months. They get private coaching, they get a small group, and they have a Nobel Prize nominee community organizer who's teaching the course. And so over the course of the next 10 months, our fellows, 90 of whom who are high potential healthcare organizers from across the country, are going to go through our 10-month community organizing training program and be activated through the 2022 midterms. And we'll see what kind of work they can do within their home institutions and home states. Building power also looks like National Civic Health Month, which is a month that we initiated and started last year, August, as a focal point for civic engagement within the healthcare community. And so we've got hundreds and hundreds of organizations like health centers, hospitals, medical schools that have all committed to doing one action in the month of August to help promote voting. Why? We are at a critical inflection point in our country with regard to how we think about voting. Who can vote and under what context has always been controversial, and it still is. It's still a battle. It's still a fight. And we all have to decide what part of history do we want to be on? Do we want to be part of the solution in helping to promote voting, helping to promote access to the ballot box, as is our constitutional right? Or do we want to be on the opposite side of that? And these hospitals and healthcare organizations have been helping to promote voting and promote access to the ballot box. And we are just getting started. This work is in its infancy, and we are so excited to be doing this work bringing healthcare providers and healthcare organizations to prescribe a new medicine, and that's voting. My name is Alistair Martin. I'm an ER physician at Mass General Hospital and the executive director of Vot-ER. And I thank you for the time and for the opportunity to talk to you a little bit about Vot-ER. Thanks.